I'm going to take a risk. I'm someone who was raised a Hindu, and my parents did not do a very good job at that. But I'm nonetheless going to quote from the Bible in order to reflect upon what compassion in medicine means to me. And so I'll quote from Isaiah. The voice said, "Cry." And he said, "What shall I cry? All flesh is grass, and all the goodliness thereof is as the flower of the field. The grass withereth, the flower fadeth, because the Spirit of the Lord bloweth upon it. Surely the people is grass." Life is transitory, the passage is saying. In the Mahabharata, the warrior Karna says, "I see it now, the world is swiftly passing." Grappling with this reality, I think, is the central theme and task of religion. It has not been felt to be a central theme and task of modern society or of medicine, however. And so we have ended up medicalizing the experience of being mortal, the experience of being transitory creatures of flesh and bone and cells and genes, of being grass. And the result of that medicalization is often suffering. Now, we have accumulated great powers to diagnose and to treat and to heal, but we do not escape the great unfixables: sickness, aging, frailty, dying. A key understanding from religion is that people live for something larger than themselves and their health and their survival. And, it's the 21st century, so we've validated it with science now. We have studies showing that we have vastly distorted our understanding of the experience of just aging, of being mortal. We assume that as we get older, as we experience these things, we become more miserable. But the evidence over and over again is showing quite the opposite. As we get older, yes, our health declines. We lose certain functions along the way. We will develop dependencies. And yet, our happiness increases. At 70 years old or older, you are less likely to experience anxiety. You are less likely to experience depression than, say, when you were 40 or younger. You're more likely to have love in your life, believe it or not, than when you were much younger. And what this brought home to me and brings home to me is that well-being turns out to be bigger in our lives than just health and survival. This was hard. This has been hard for me to wrap my mind around. If you have asked, is my first priority as a clinician your health, preserving your independence? I would have said, of course. That is why I went into medicine, is to help people preserve their health. But then we are lost when health is not necessarily possible. When people, go on to become older. What does it mean my job is then? What does it mean our job is then? And what I learned from talking to patients, talking to people who are really good at dealing with situations that you may or may not be able to fix, is that they have recognized something bigger than health. They've recognized what well-being amounts to. And that is the idea that people have priorities in their lives besides just living longer. They have reasons they want to be alive. And those reasons are the things that give them joy and the things that are their loyalties, the things that they would sacrifice their joys for, that you would sacrifice your own life for, that you would go through pain for. Those are the reasons you want to live, and those are the priorities that you want others to help you live for. Now, the difficulty is that we all have different loyalties and different things that give us joy. Our loyalties, the things we live for that are larger than ourselves, might be our children. They might be our family. They might be our country. They might be ideals like justice. They might be concepts like beauty or for God. Whatever they are, what's important is knowing what your priorities turn out to be. And the most reliable way we have to learn what your priorities are is a highly technical procedure. We have to ask you. And we don't ask. By the time people come to their death, caregivers, clinicians, have asked less than a third of the time what really matters to people along the way. And families may not have done any better. And the reason suffering results is because then what we do for people, our care, can end up being out of alignment with their priorities, with what gives them joy, with what their loyalties are, with the reasons that they want to be alive. And that is when you get suffering. What I've slowly learned later in my career, years after medical school, is that there are ways to ask. From geriatricians, from palliative care specialists, from hospice workers, from nursing home aides I've met along the way. I've learned some of the questions that they ask, the people who have that art of compassion, who seem to know what it is to connect to another person. And it's fundamentally about listening, the ability to talk less than half the time you're sitting with somebody. And that requires your asking questions. And those questions are ones like, what's your understanding of where you are with your health or your condition? What are your fears and worries for the future? What are your priorities and goals, even if your health worsens? What are you willing to go through, and what are you not willing to go through? Does your family know the answers to these questions? One of my colleagues told me about a conversation she had with her own father as he was facing a dangerous operation. And she asked him these questions. And his answers came back telling her what really mattered to him along the way, what he would be willing to go through anything for in order to, what the minimum quality of life is that was worth staying alive for. And what he said was it was chocolate ice cream and football on television. If he could eat chocolate ice cream and watch football on television, that would be enough for him to consider worth living. He would be willing to go through a lot as long as he could have that. I talked to another person, it's become my favorite question to ask, what's the minimum quality of life you would find worth living for? And I met, a minister of health from a major country, and so I asked him the question. I said, so, is it your family? Is it your wife, your kids? Not really. We've had our issues. But if I could at least still read a book and just have that chance to still read a book, that would be enough for me. I got to make a film version of Being Mortal, the last book I wrote for PBS Frontline. And it was an incredible process, because what we did is we followed a lot of patients through their experience of being diagnosed with a serious illness, and then weathering the bumps along the way, all the way to the end of their lives. And some, there's one story, there's an incredible bond, and another story, we just didn't ask those questions. We just didn't. And then you meet her, and she's in the hospital, and finally we ask her, what matters? What do you fear losing? What would you most prioritize? And you meet her, and she says that, if she could just do anything, she would want to take her grandchildren to Disney World before she leaves this earth. And it is totally heartbreaking, because she is in the hospital and she is never going to leave. She died 2 days later after explaining this. And you realize we could have known that along the way. We could have made that connection and done something about it. Medicine often sacrifices life, sacrifices your time now for the sake of possible life later. And we have rising areas of medical care, whether it's geriatrics, palliative care, and other fields, that are really thinking about, how do I give you your best possible day today? It's not either or. You don't have to give up the chance at having a good day today in order to have care and treatments about possible life tomorrow. And the consequence of making choices that involve having your best possible day today doesn't have to mean your life is shorter. You can live better all the way to the very end. And that's a lesson that applies long before those final weeks that you have in their life. I started writing that book out of trying to understand what it meant to be competent, what it meant to be good at taking care of people facing even the end of life. But the lessons, it turns out, matter at every point along the way, long before you ever face the end of life. It is lessons about what your priorities are besides just survival, besides just health. And we can ask. Our job in medicine and as families is then to listen, to really listen.